Hi everyone. I'm just going to add Dr. Sunita. Give me a few minutes, please. Hello everyone. I am just waiting for Dr. Sunita to join in. So, just a few seconds. We're going to have a very interesting chat. It's about anemia. So I'm really looking forward to this, but I'm just waiting for Dr. Sunita to join in. And yes, if you all have any questions, please feel free to throw them in. I'm just waiting for her to join in now.
Asatya.
Hi, doctor.
Hi, Nisha. Hi, how are you?
Very well. How are you?
Very fine, dear. Very fine. Nice to meet you. And thank you for
Likewise.
doing such a good work for the noble cause.
Thank you as well. Let me quickly introduce you to all my followers. Guys, this is Dr. Sunita. She's a world-renowned obstetrician and gynecologist. She is a specialist in IVF and infertility and has over 34 years of experience. So I'm very glad that you're joining us today, Dr. Sunita, and I'm so excited to talk to you.
Same here. Same here.
So, can you quickly tell us a little bit more about what you do?
Okay. Nisha, I'm sorry.
No problem.
Nisha, I am Dr. Sunita Tandulwadkar. I am a gynecological endoscopist, IVF consultant, and high-risk obstetrician. I'm at Pune. I head the OBGY department of Ruby Hall Clinic, which is one of the biggest and the oldest hospital of the city. I also head IVF endoscopy department there. DY Patil Medical College, Pune. I head the IVF endoscopy center there. I'm a director of Solo Clinic, the Center of Excellence in Infertility Endoscopy. I'm also president of our All India Gynae Endoscopy Association. Maharashtra IVF consultant. So there are many more things. Let's move on to the main topic. And the biggest thing is a great friend of Namita, who is absolutely taking the flag of MQR ahead. I'm thankful to her for taking this initiative and bringing awareness about anemia and women health. It's a noble cause.
It absolutely is. I completely agree. So why don't you throw some light to begin with about why is anemia under the spotlight right now? Why are we talking about it? Why is it so important to discuss?
Actually, Nisha, we are talking about anemia for years and decades because anemia affects the woman health. It
Hmm.
affects in pregnancy
Correct.
tremendously. If you are aware, 60% of a woman in India, they are anemic. 20 to 40% of a maternal deaths which happens during pregnancy or labor are because of anemia. And we gynecologists are always educating the people, but unfortunately, we can't reach out to the masses. And that's why I think Namita's this program, because MCure is working in this field for, to my knowledge, more than 2 decades. And we are trying to reach out and improving the woman health.
Right, right. Such a noble cause, honestly. Okay, why
Yeah.
don't you tell us in simple words what exactly is anemia? For I'm sure that everyone knows it, but let's just break it down for just in case someone doesn't.
Okay. So anemia means low hemoglobin. Hemoglobin in your body, ideally in a woman, should be at least about 12. While in men,
Right,
we say it about 13, 14. So if the hemoglobin is low, we call it as a anemia.
right. Okay. So what does more than 38,000 for more than bara symbolize?
Okay, so as I say, we, the Gynecologist Association called FOXY, Federation of Obstetrics and Gynecologists of India, it is the second largest organization in the world. And
Mhm.
we, 38,000 is the member strength, which we are working across nation for the awareness of anemia with the help of MCure. And that's
How
why
lovely.
38,000 figure.
How lovely. How lovely.
Yeah.
Okay. That takes me to my next question. Why is the number bara so important for every woman?
So we want to get this awareness of bara. Bara means your hemoglobin should be 12.
Count.
So every woman, it may be an adolescent girl, because the most anemic people in the country are either the adolescent woman or the pregnant woman.
Oh,
Okay, so everyone should understand. If you go to the college, ask them last movie release, they will know. They will know each and every gossip of every actor, actresses, and everyone. But if you
right,
ask what is your blood group and what is your hemoglobin, they have no knowledge. So we want to spread across all women. Just check your hemoglobin and ensure it is bara and
right,
above.
right.
So
Such an
can I
important.
ask you,
So,
Nisha, what is
sure,
your hemoglobin?
it's actually bara.
Okay, because
Exactly bara.
I did it last month and mine is 14 and I don't take
Wow,
medicine. It is only with the diet. So we'll come to it,
lovely.
sure.
Yes,
Hmm.
please. You need to tell my audience how they should, with the help of food, increase or maintain their hemoglobin. So we'll
Okay,
come to
so
that. Let me finish
yeah,
my other questions first.
right,
Who do
right.
who who do you think stands the risk of not being more than bara?
As I said, pregnant woman and adolescent age group, they are more at risk. See what happens,
Hmm.
in a pregnancy, the
Hmm.
our nature is great. The mother adopt her body in a such a way that it is healthy for her heart, for her body, and also for the baby growing. So in pregnancy there is a dilution of the blood, and when there is a dilution, it automatically will decrease the hemoglobin. So
Right,
if the RBC count, the fluid increases, so that the blood flow to the baby should go more. The load on the mother's heart should decrease. So there is a dilution. But when there is a hemodilution, automatically, physiologically, every woman, if her hemoglobin is 12, for example, you, Nisha, during
correct,
pregnancy, your hemoglobin will be 10.5.
right. So that's why you have to supplement it with iron.
Yes, yes.
Correct, correct. Thank you. That
Thank
that
you.
that really made a lot of sense. What is the importance of iron in blood through adolescence and pregnancy? I think this was similar to the
That is
previous.
the
Yeah,
similar thing. Now, how
yeah.
hemoglobin is formed? Hemoglobin is formed with iron. Most important three components is iron, B12, and folic acid. These
Right.
are the three components you need. And that's
Hmm.
why you have to see that your diet is adequate with all these three
All three.
components.
Right, right. Do you think we can ever become anemia-free India?
We can, if we have such a strong company who works more than a pharmaceutical as an NGO, doing such a nice, I believe this is their CSR activity. We have the people who like Nisha, who have a huge followers on the Instagram, and we have the gynecologist and obstetrician who are willing to take out their time and spread this across. It will work, it will work, and we should all become. I go one step ahead. We should have said 2020 free of anemia, because it becomes logic. So now
Right.
let's say 2022 bara.
Definitely. Let's all work towards it together.
Yeah, yeah.
Yes. What do you think is the first step towards an anemia-free India?
First step is awareness, which
Mhm.
we are doing. Second step should be every woman, from girl of adolescent age group, 12, 13, 14 also, to everyone, even in a postmenopausal age, checking their hemoglobin.
Right.
And third thing is, in a pregnancy, we all know that there is excess need of iron, but otherwise, with the diet, we can improve our hemoglobin. So awareness about what diet contains good amount of hemoglobin.
Correct. So can you please elaborate on what we can do sitting at home without taking supplements? Of course, I'm not talking about the pregnant women. I do know that you have to supplement your diet with iron supplement or pill as such when you're pregnant, because I remember doing that. But otherwise, for all of us, how do we incorporate foods that help balance or maintain our hemoglobin?
See, why we are talking about adolescent, the most important food is a green leafy vegetable. And you see in India, how many young girls take green vegetable. We don't. So first
Right.
of all, we should know we may have a vegetarian group or a non-vegetarian group. And usually non-vegetarian, when they eat meat or chicken, which are a very high iron content, but
Mhm.
vegetarian don't have to become non-vegetarian for that. The
Absolutely.
spinach has the more amount of iron than the same serving of a beef.
Wow.
Soybean, lentils, all lentils, pulses, they take enough pulses in a diet. We take a black raisins. The simple thing is groundnut and a jaggery. If you see in villages, we all tell शेंगदाना गुड़ का लड्डू खाओ रोज एक छोटा सा घर में बनाओ. You don't have to go to the market. You just
Right.
शेंगदाना गुड़ का लड्डू अगर रोज खाए तो it has a huge amount of iron. So
Right.
jaggery, groundnuts, black raisins, lentils, soya beans, all these are very, and every green item will have it.
Right.
Tomatoes, they have a huge amount of it. Beetroot, you have a huge amount of iron in it. So if your balanced diet, I feel Maharashtrian Brahmins, they are very good. They will daily have some amount of sprouts, some amount of jaggery. If you see in Jain Samaj, anyone comes from outside, they give a jaggery in
Hmm.
hand and then a water. So it has our culture 100, 200 years ago. This was with the diet, how they used to take the hemoglobin. Good ka pani, Jain Samaj take a lot because they are very strict in their vegetarian things. So
Right.
that's a beautiful thing they do. So every
Right.
young girl should see. Now, if those mothers they are listening, the young girls they are listening, they all should understand how their diet should be. Don't need to be non-vegetarian. With vegetarian
Absolutely.
also, you need to be very good with all these things.
So basically, you should make your plate as colorful as possible, right? With
Yes.
beets, greens, and yellow, and all the
Oranges,
colors.
yes,
All the
yes,
colors you
yes,
can find.
yes. We say five colors of fruits and five colors of salad. If you consume every day, you are full in your body with multivitamins, micronutrients, minerals, and a very boost up in immunity. You don't have to
And
worry. You will
and
never fall sick.
you'll also be bursting with energy.
Absolutely.
So very recently, doctor, I have made this entire change in very recently. In fact, thanks to the lockdown. we made this change in our diet, my husband and I,
Yes.
where we incorporated and made sure that our plate is as colorful as possible, and we are trying to avoid wheat and rice for whatever our own personal reasons. But we've seen so much of a difference in terms of energy and immunity and all of that. So what you're saying is not only for hemoglobin, but a good diet is valid for everything. It's good for everything for
Everything.
you just in any way. Right.
Yes,
Absolutely.
yes.
Great. Thank you, doctor. And could you throw some light on exercising and how important is fitness in this journey?
See, hemoglobin is one part. Now, how do you know your kid is anemic or you are anemic? Easy fatigability, easy
Right.
exhaustion. The same
Mhm.
18-year girl, another girl is bubbling with the energy, not falling sick with every change in the season. And your
Mhm.
child is not coming from the school or a college, exhausted, tired, not interested with everyone. First thing is it may be anemia. Second
Right.
important thing is falling sick again and again with the viral cough, flu, common cold, headache, body ache. All this is also low immunity, and that's why because of anemia. Diet, exercise, yoga, meditation. As you say, Corona has given us a lot of time to
Right.
self-review ourselves. What are needs of our, we were running behind something. I don't know what we were doing.
Right.
And we
Right.
all are now concentrating on diet, exercise. So maybe 1 year down the line, we'll be all very healthy and immune and highly knowledgeable.
Absolutely. Absolutely, doctor. Doc, I'm just going to go through the questions what the audience have shared. Just give me a minute. Can you throw
So
some
when
light on autoimmune hemolytic anemia? Somebody has
Okay,
asked.
that will be, yeah, that will be a totally different ball game altogether in their body, autoimmune system, genetically inherited, and that's why they have a hemolysis of the blood. Okay, so anemia, we are today talking only about the nutritional anemia, which is self-corrected,
Correct.
auto-regulated. But there is
Right.
sickle cell, there is a thalassemia, there is so many hemolytic and so many other group of, it may be just the vitamin B12 deficiency anemia. These are
Right.
the different subgroups. So today our focus is mainly nutrition and
Right.
nutritional anemia.
Great, which I think you have perfectly thrown light on, Doc. Thank you so much.
I,
Is there
I, I
anything
think
else you'd like to say?
yes, in a pregnancy, the
Hmm.
pregnant woman, first pregnancy, Nisha, everyone is so,
Careful.
enthusiastic. The husband will come with the life, with the tremendous love, will give you a iron tablet, calcium tablets, and all. But with the second and subsequent, they become lethargic. गोलियां daily नहीं लेते हैं. So one thing I want to tell to all pregnant women, every baby needs equal attention. Second thing
Absolutely.
is, in a pregnancy, your requirement of iron is 9 times higher. And that 9 times higher cannot be just adequate with the diet.
Phil.
And you need to consume pills. Now, there are two, three important things about the iron pill, do's and don'ts. I want every pregnant woman to know. One is iron absorption. There are certain factors which enhances and certain factors which inhibit. So you may be popping the tablet, but your hemoglobin is not coming up and the blood reports are showing low iron. So if you take vitamin C along with the iron, it
Iron.
absorbs. So I'm not saying ki pop up the vitamin C. You may take a limbu pani with the
Correct.
vitamin C. You may take a orange and the iron tablet. You may take a sweet lime and the orange your iron tablet.
Iron tab.
Now, if you take sometimes these iron tablet can give a gastritis, and that's why they love to take it with the after food. No, don't
Right.
do that. You delay the absorption. People are lazy, so they take iron and calcium tablet all together. Calcium doesn't allow the absorption of iron. So you should
Right.
not be taking iron with the calcium tablet together. Calcium is rich in milk. So don't take iron tablet with the milk.
With a
Don't
caffeine.
take iron tablet with the curd or a lassi. Don't take iron after the food. So all these, now sometimes they take an antacid with the iron tablet. If the antacid is rich in calcium, so see the contents. And if antacid is rich in calcium, then don't take that antacid with iron. So important is you just see to it that you are taking before meal, maybe half
Correct.
hour, 1 hour, but
Correct.
don't consume with meal or don't consume calcium iron tablet together or with milk. These are the small tips I want to tell all pregnant women.
And they are so important, Doc. They're so important because so many people don't know about. I didn't know that you should take iron along with vitamin C.
Yes,
That's
or
such a
with the
good point.
lemon, with
Oh,
lemon or with
yeah,
oranges, citrus
any form of
fruits.
vitamin C. Correct.
Yes, but one more important thing now, we all have changed. Listen, what happened, Nisha, it is very easy for us as an obstetrician to tell the patient, okay, daily consume the tablet. But if I have to take myself any antioxidant, I'm 57, I forget at least 3 times in a week. You
Correct.
understand? Unless my cook comes
Absolutely.
and gives me. So
Right.
another important thing is injectable irons are available. Again,
Right.
thanks to MCure, they kept on doing so much research. The injectable iron 35 years ago, when we were doing our residency, they were only intramuscular, painful, having lot of complications and
Right.
consequences later. Now they are available IV. So
Correct.
you take one dose, that is the carboxy maltose, FCM, ferrous carboxy maltose. I want everyone to remember this trade name, this name generic, carboxy maltose. Now what happens, I can give
Mhm.
1000 also to the pregnant lady. So if I give her in a
Right.
fourth month of pregnancy and again 7th month of pregnancy, another dose, throughout 9 months, she don't have to take iron. So I can go and you can go to the obstetrician and say, give
Right.
me ferrous carboxy maltose. It may be expensive,
Correct.
maybe 2-3 thousand
Right.
rupees, but it is equal to your 3 months, 5 months popping of the
Or
capsule,
fine.
which ultimately
Right.
costs the same. So take
Right.
one iron before. For my patient, all I give them in fourth month and I repeat them at 24 to 28 weeks of pregnancy because I want their hemoglobin at the time of delivery 14. Because every
Right.
delivery, whether you do normal or cesarean, you have between 100 to 300 cc blood loss. So 14-gram
Absolutely.
hemoglobin becomes 12.5, 13. You are still energetic. You are doing your lactation. You are giving immunity to baby. You are yourself doing it. But your hemoglobin at the time of childbirth, is 11, you become 10, 9, you are lethargic. You don't have energy
Right.
to take care of your child. You need a servant's
Absolutely.
then. So all these small things are important. By 36 weeks, try to make your hemoglobin 14 gram. It will be fantastic. So all my patients who are at the age of even 50 undergo laparoscopic surgery, removal of uterus, tumor, anything, we do now keyhole surgery. They go home in the evening. I give them one
Right.
FCM dose. So they are within 10 days. The another advantage is oral tablet take 1 month to develop the hemoglobin. While these
Right.
injectable, they in 10 days, it can make your hemoglobin rise by 1 gram. So even the major surgery, my patients will go home healthy. I'm not here only about, see, our community means adolescent age group, reproductive age group, and menopausal and perimenopausal and postmenopausal age group.
Right.
Every lady needs hemoglobin about 12. So at the
Absolutely.
time of surgery, before surgery, if hemoglobin is 13, and after surgery, if hemoglobin is 12 or so, I just give them, they become so healthy, energetic. Immunity development means no infection. That's the most
Doc,
important thing.
right. Doc, I need to ask you something over here. I remember being prescribed FCM post-delivery, like
Yeah,
a couple of months ago. But
yeah.
there are myths about it having side effects and, messing with your stomach or something like that. Could you
Nah, nah,
just
nah. I'm so
Burst those
sorry. I'm
myths.
sweating because I came out from the operation theater. Okay.
God.
No, bacha. This FCM, ferrous carboxy maltose, which we are talking about, is devoid of any side effect. It can be given in, usually what I do, 100 cc of a normal saline. I put this and I put vitamin C also and B12 also to the patient. And you can give it in 15 minutes. The another
Right.
component once in a while can have an anaphylactic reaction. We used to give a little slowly, but FCM is fantastic, and the studies have proven it. In India also we did the studies, and they have proven to be safe in pregnancy. But usually we
Right.
give after 3 months of pregnancy.
Great. Perfect. That was really helpful. Now I know I can go and freely take it. Thank you so much, Doc.
Just take it. But you are 12
Yes.
gram. So even with the
Yes.
diet, Nisha, you can maintain it. You may not need it
Absolutely.
because you are not
Right.
pregnant, and you probably your obstetrician did a good job of giving you after delivery. So you remain so
Absolutely.
energetic. I can see you have done a lot of exercises and took out all the weight pregnancy gives you.
I have, like I said, this lockdown has been beneficial in many ways, apart from the fact how much we all hate the pandemic. But yeah, it has given us time to introspect. It has given us time to, relook, rework our eating habits and form many new habits.
Exercises and diets. Yeah.
Absolutely, absolutely. So yeah, a quick summary, guys. Everyone, remember, iron is extremely important. Having a balanced diet is extremely important. We need to remember to take our supplement, our iron supplement, along with vitamin C, preferably before eating our meal. So I think before breakfast would be a great time, Doc. What do you think?
Usually my pregnant woman, I advise them the meal at 7 o'clock, 7:30 in the evening, and
Hmm.
10 o'clock they can take that tablet and go
Perfect.
to sleep. So even if little gastritis, it goes in a sleep time. While their
Right.
calcium, I ask them to take in the mornings.
Morning. Perfect. What a helpful tip. Thank you so much, Doctor.
Thank you, Nisha. Lovely meeting you.
Likewise.
Bye
I'm going to
bye.
quick 1 second. I'm going to check if there are any more questions before we go.
Yeah, yeah. Meanwhile, I would love to say thanks to Namita. She's always concerned with the woman health and woman health related initiative. I think ये बच्ची एक दिन पद्मश्री मिला के रहेगी.
I hope so. Everyone who's doing good work deserves it. Mhm.
Thank you.
So,
Thank you, Nisha.
thank you, Doctor, for all the amazing work you are doing through the
Even
Corona
if
time.
10% of the people they follow it, we have utilized our time beautifully today.
Great. I'm sure they will.
Thank you, Nisha. Lovely
Thank you,
meeting you.
Doctor. Likewise.
Thank
Take
you.
care.
Bye.
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 Bye. Bye, everyone. Thank you for joining us.